Willie Rennie.
A new Freedom of Information request has found that adult mental health waiting times are getting worse. 1,000 adults waited over a year to get access to mental health treatment. That's more people waiting for longer. Will the First Minister accept that access to mental health services is getting worse in this country?
First Minister.
Well, as I said in response to an earlier question, we're seeing increased funding in mental health services. That's important and I hope will be welcome. We're seeing a growing workforce to deliver mental health services, and we're also trying to rebalance care away from often hospital and GP care more into community settings where people would benefit from preventative mental health services. All of that work is encapsulated in our mental health strategy, backed by additional funding. In terms of the issue about adult waits are not yet where we want them to be, and the Mental Health Minister is working closely with local health boards to improve the situation, and it's important that that work continues. But just for context, the average wait in Scotland amongst territorial boards is 7 weeks. It ranges from 4 to 17 weeks, and that's published data. So that gives some context, but of course we continue to work with health boards to improve that situation and consider that to be extremely important work.
I don't think the First Minister understands. The number of people waiting over a year has doubled since the day that she appointed her dedicated mental health minister. Since Christmas, I have challenged the First Minister about specialist perinatal mental health services. In half of Scotland, there are none. I have challenged about waiting times for children. They are longer. And I have challenged her about her suicide prevention plan. The wait for that goes on and on. The First Minister tells us that the service that people receive is getting better, but the evidence says that she is just plain wrong. People with poor mental health deserve an answer. Why are mental health services getting worse in this country?
First Minister.
Well, a number of issues raised there. Willie Rennie is right to say people want answers, so let me give him specific answers. If I go through briefly the particular issues he raised. Firstly, in terms of waiting times, we want to bring waiting times down, and particularly we want to bring the longest waiting times down. But I said previously in relation to adult waits, the average wait is 7 weeks. For child and adolescent mental health services, the average wait there is 10 weeks, with 11 out of 14 health boards having an average wait of between 5 to 12 weeks within the 18-week target. So that's the context, although we continue to work hard to improve that even further. In terms of perinatal mental health, an issue that Willie Rennie has raised before, and I know the Liberal Democrats have issued some suggestions there today, which are very welcome. As I said the last time, we have established and are funding the Perinatal Managed Clinical Network. The clinical network brings together specialists in perinatal mental health, nursing, maternity and infant mental health, and is working to improve the recognition and treatment of perinatal mental health care. And lastly, in terms of the suicide prevention strategy, many people, including Willie Rennie, across this chamber asked us to do more work between the draft strategy and the final strategy. That is underway. The final strategy will be published, I understand, before the summer recess. But perhaps this quote from the Samaritans help again to give some context. The Samaritans, who had raised some concerns about the draft strategy, said recently that they are encouraged by the commitments made by myself and by the Minister for Mental Health that the final strategy will cover more of the recommendations for change from the pre-engagement report that was shaped by those with experience of suicide. So all of this is similar to my replies from Richard Leonard. I absolutely recognise the importance of mental health. We are, of course, in Mental Health Awareness Week. There are more people coming forward for mental health services and treatment. That's something we should continue to encourage because it shows the stigma from mental health continues to reduce. Our responsibility is to expand the capacity of services, and that is what we're working to do across the whole range of issues that have been raised today, both by Richard Leonard and by Willie Rennie, and we will continue to do exactly that.